Hi, welcome to the Divine Insight Show. Thank you so much for joining us wherever and whenever you're doing so. I am thrilled to be here with you today. Very excited to introduce you to Wendie Colter. Wendie has been a professional medical intuitive for 20 years and is the leading trainer for healthcare professionals. Based in Los Angeles, she has effectively taught doctors, nurses, psychologists, therapists, energy workers, and health professionals how to use medical intuition in their practices. Her early education included participation in Louise Hay's renowned intimate living room healing sessions in Brentwood, California. This led to intensive study in various energy modalities, including Usui Reiki, crystal healing, transcendental meditation, transformational coaching, and NLP. She's enjoyed a thriving private practice in LA for 20 years and has been teaching intuitive development and energy medicine for over 10 years. She founded the Practical Path to present her unique accredited certification programs in medical intuition for health and wellness. The company name reflects her mission to fuse spiritual wisdom traditions with constructive, real-world results. A highly sought-out expert on medical intuition and energy healing, Wendie is a published author and has lectured and taught at prominent educational and health centers. These include the University of California, San Diego School of Medicine, Prebys Cardiovascular Institute at Scripps Health, San Diego, Andrew Weil Center for Integrative Medicine at the University of Arizona, Academy of Integrative Health and Medicine, and Institute of Noetic Sciences, among others. And the University of California, San Diego School of Medicine announced in their 2019 collaboration with her a fresh research study on medical intuition based on the remarkable results of her pilot study of graduates of her program. Debbie, thank you so much for joining. Oh, sorry, Wendie, thank you so much for joining me today. Welcome to the show.
I'm happy to be here. So thank you, Travis. Great to see you.
You bet. Yeah, made it through that, and it's so
You
funny.
did,
We're
you
just
did.
joking on the show that people call me Charles, and I just
Oh my gosh. And you just called me Debbie.
Debbie.
Well, maybe
So
it's my
I
spirit.
know, so funny. Yep, instant karma. They tell us that means we're more powerful, right?
It's okay.
So, as we were talking before the show, you have been so immersed in this work for so long. It's just a thrill to talk to other people, particularly people like you who are in very much on the cutting edge of the connection between mind, body, spirit, and the physical body. So
Yes.
I'm so excited to have you on. So let's just dive right in
Sure.
and talk about this. What is how do you define, or what is medical intuition?
Well, medical intuition is a skill. It's not a modality or a method in that respect. A lot of people confuse it with a healing modality. It's not a healing modality. It's actually a skill set to view the physical body as if we're looking at an MRI or, that sort of thing. We can look right in. And
Mhm.
also the biofield, which is, of course, the auric field. It's that electromagnetic field that surrounds the body, permeates the body. So that's the auric field and the chakra system. So we're looking at both things, and we're looking at both things for a couple of different reasons. Number one is to get a good view of whatever physically is going on. Like I mentioned, looking at the body as if we're looking at really like a functional MRI. We can see things, we can look at related systems. Also, we look, and the biofield, to see where the congestion is and blockages are. But we're also looking for life history, and there's a reason for that. We want to know where something began that could have manifested in a physical imbalance or an energetic imbalance. And that is like the whole scope of what a medical intuitive who practices the way I teach, for one thing, which is a real big, it's like a 360 view. It's a holistic view. So we want to know the underlying root causes, not just physical, but also a mental, emotional, and spiritual. And medical intuition, when it's practiced the way, the way I do it, my methods and my students, that's what we're doing. We're looking at the whole thing. And I know there's some confusion out there about medical intuition, because some people think it's getting a flash of insight about, and you mentioned a story before we went on air about seeing a pancreas in someone you were
Mhm.
working on in a Reiki session. That's fantastic. But that's not strictly medical intuition. That's the beginning of it.
Mhm.
And what you can do with that insight And that ability to like, oh, I just got a hit on something. And everybody who, listen, all humans have this. We all get hits on things. But when you get hit on something that has a, kind of a healthcare part to it, that's a great place to start to learn how to expand it and have it become a dialogue between the medical intuitive yourself and the body and energy systems of your client. That's a whole other experience, really.
Right. Yeah. Thank you. And I understand that you recognize that you had intuitive skills quite early in your life. Can you
Yeah,
talk a little bit about what that was like for you?
sure. Now, let me preface this by saying everyone is intuitive. Intuition is our birthright. We don't recognize it in our culture, and very often intuitive children are told, be quiet, and that's being nice. They're
Right.
not
Or
listened
like a
to.
guest that I had last week was
Yeah.
like, oh, potentially people like us were institutionalized.
Yeah, well, yeah, way back when. And what we want to do is, acknowledge our intuition. And there's a lot of ways we can do that. But you asked me about my early life. Well, I didn't,
Yeah.
my experience might be different than others. I did not have a near-death experience. I did not have like an impactful trauma that created, sort of all of a sudden new gifts or powers. I developed my intuition over my lifetime slowly and deliberately, and did not know I was doing that. When I was very, very little, when I thought back, I remembered one of my very first intuitive experiences, and it cracked me up because I'm like, oh my gosh, I was at 6 years old. um, I remember driving in the car with my mother and humming a song to myself and saying to my mom, turn the radio on. There's a song I like that's playing, Mom. And she turns the radio on, and there's the song right where I was singing it in my head. And that is clairaudience. That's a
Hmm.
kind of intuitive skill. And I kind of trained myself over the years to notice those and just kind of play with it. It was really a fun game for me. And a pivotal moment happened for me quite a long time ago. I was an adult, young adult, and my body developed a little tumor. And I had just read Deepak Chopra's book, Quantum Healing. And
Mm.
in Quantum Healing, he talks about how he helped use his patients use mind-body visualization techniques to shrink their tumors. And the tumor, luckily, was benign. And I went to see my doctor about it, and she said, well, let's surgically remove this anyway. Let's not have this be a problem for you. And even though it's benign, let's take care of it. And I said, no problem. I just read this great book by Deepak Chopra, and I want to try to shrink it with my mind. And I will never forget this look on her face. You know how dogs do this little, what are you talking about? Like tilty thing.
Right.
And she said, okay, fine. It won't hurt you. So what I did
Mm.
in that 2 weeks before the surgery is I used mental visualization. Really what it is mind-body visualization to shrink that tumor. And I got a little image in my mind of little fizzy bubbles that were very happy and
Mhm.
giggly. And I just, in my mind, scrubbed and watched that little tumor dissolving away. And it was just a little mental game. And I'll tell you what, 2 weeks later, when I went to the doctor, uh, for the pre-op exam, I hear her gasp and sort of go, huh. I'm like, okay, well, I must be dying. And she said,
Didn't work.
didn't work. She said, what did you do? Huh? Well, it turns out that the tumor was about the size of a nickel, and it shrunk to the size of a pea in that 2-week period. And it wasn't that kind of growth. It wasn't going to just dissolve on its own. And that's one of those experiences in life, and I'm sure many of your listeners have something similar that they can relate that to, where something happened or changed for no obvious reason, only that they used a mind-body technique. Um, and that was sort of my off to the races. I went, okay, something just happened for me personally. This is no longer in the realm of theory, or something that I
Mhm.
could discount. And I became an energy healer, and I studied, many modalities. And I realized that in my energy healing, just like you, Travis, I was seeing into the body. Every time I did an energy healing, I was like looking in. But not only was I seeing into the body, I was also seeing the origins of the issue. I was
Mhm.
seeing their life experience, where it began, what emotional impact created this long-term imbalance that resulted in this issue. And I was getting calls from doctors, quietly under the radar. Can you look at a patient for me? And all my colleagues were sending me their tough cases. And I realized that this is actually a major gap in healthcare. I'd been working with clients long enough to know that there's a lot of missing pieces in traditional healthcare, and there actually even are missing pieces in complementary healthcare, because everyone sort of looks through the lens they were taught through, right? There's nothing wrong with
Mhm.
that, but it makes a world full of specialists and not a world full of people who can actually see the whole 360 view for someone in terms of their health. And that's what medical intuition really is. Um, and that is what I do. That's what I practice, and that's what I teach. And this is why I teach people in the healthcare profession, the wellness professions, because this is like what's going to change medicine. you know? Uh, and that's my goal, is to help medicine understand that there is a mind, body, spirit attached. Now, mind, spirit, and mind and spirit attached to the body. Put it
Mhm.
that way.
Yeah, so true. And when I was back up in Seattle, I participated as a volunteer at Evergreen Hospice, where they had incorporated Reiki into hospice care.
Wow.
And it was very interesting because at the time that I was doing it, the idea of it and then what people were expecting as patients weren't quite the same. I think a lot of folks believed that it was some form of, physical manipulation like massage, and they kept wanting me to rub their bodies in some areas, and I'm like, I'm not trained in this technique, but here's, I do hands-on healing, and there was some great benefit and relaxation and things, but from the standpoint of what you're talking about, if that's not going to the cause of the issue, and
No.
by that point many people are so far along their energy imbalance that it might be something that unless they go to that source, they might be unable to actually understand or change the thought patterns, the emotional patterns, the self-destructive or self-abuse patterns that existed in their bodies.
Yes.
What led you to develop your medical intuitive program?
Well, a lot of things, mainly that gap I was talking about, and everything you just perfectly stated about the misunderstanding out there about where the origins of issues. There's something out there called ACEs now, adverse childhood experiences. You might have heard this term. The
Not yet.
yes, ACES. And if you look it up online, there's a ton of information and a lot of research going on. And what the premise of that is, and this comes from the psychology world, is that early childhood trauma leads to, or can lead to directly, a direct line to adult physical imbalance, not just depression or the obvious kinds of things, or maybe addiction or behavioral issues, but also cancer, uh, uh, respiratory issues, gut issues, on and on and on. They're finding the research really corroborates this connection. And let me tell you, everybody's had some form of childhood trauma. You kind of can't be a kid
Mm-hmm.
without getting some sort of, and then we have really, heavy duty trauma like abuse and things like that. So it's an interesting thing to look at from the medical intuitive perspective. But when I started seeing, this is really what led me to start my classes along with my own personal experience. When I started seeing that a medical intuitive assessment, which is what it is, it's not a healing modality, it's an assessment first. When I saw that when I did that process first for someone and checked to see if my personal modality, excuse me, pardon me, if my
Nope.
personal modality was going to be effective for them, or if something else might be effective for them, what I would hear back from my clients later is that session brought me so much awareness of where things need to shift in my own life experience, not just in health, but in every other area that led to this imbalance. I mean, it put it all together for them. And they were
Mm-hmm.
healing, many of them. What they told me was, we're just getting more information. And that information I can take to my healthcare provider, which is really important. That information I can take to my psychologist, if they want to go there, that's important. It moved people along their healing journey faster. And the doctors that I used to work with and still do got information that their testing might have missed. Or they were, trying to figure out what was going on with someone, and I could say, well, here's what I see. and they could test that, and they'd say, yes, that was correct, we missed that. So, or it helped solidify their diagnosis, perhaps. Whatever it
Right.
was, we found
Yeah.
people moving faster and faster through their healing work, and just the information is so invaluable for people to know where the root cause is, and not just the physical one. You know, what do doctors do? They say, okay, you've got hypertension, therefore reduce stress. Well,
Hmm.
what stress? Where stress? You know, what are we talking about here? A medical intuitive's job is to look at that, first of all, for physical body stress, and secondly, for emotional life stress. What's going on for them that's causing them this imbalance? It's invaluable.
It's so
So,
wonderful, the work that you do. It's very interesting because as I got involved in this about 12 years ago, when I was like, wow, there's really aspects of ourselves that we're ignoring that could really help us heal our
yes,
lives in a totally different way. And you know, when you're talking about that, I immediately got a picture of the 15-page form that we fill out before we see a new doctor.
sure.
And how great would it be if we had, you know, a triage at that entry level that said, okay, here's the physician aspect of the medical issues that you're facing. And maybe we have symptoms we need to treat at some level because they're acute. But also, here are the other aspects of our being that we need to understand and have a relationship with more consciously so that we can shift it into a place of balance. And I just
Yes,
love that. You
that's
know,
exactly
it
it.
does remind me as well, because a lot of the work that I end up doing with people, which surprised me, frankly, was that I started to see past life traumas that
Sure.
were existing and imbalancing folks' ability to trust themselves or be empowered or live freely in this life as well. So
Yes.
it's so interesting, you know, as we understand more about our consciousness and more about the relationship between our mind and our bodies and our frequencies, that we actually have to take a broader approach to understanding how all that interplay goes or doesn't go. And so that's why I'm so excited
Yes.
to have you on here. And I want, you know, your program is so powerful. I was really caught by the significance of some statistics that demonstrated that those who have done your program, and the studies show that they have 94% accuracy to a
Yeah.
medical intuitive diagnosis. I'll
No, it's
put
not a
that in quotes.
diagnosis.
It's not a
Actually,
diagnosis. Can you
it's not a
explain that a little bit?
diagnosis. Sure. Let me explain the difference. So, yeah, we recently completed our survey. We worked with 67 self-selected people, and 5 of my graduates who had just completed their level 2 program. And that's a 9-month program. So within 9 months, they were getting these very high accuracy rates. And I'll explain that. The word diagnosis really belongs to licensed healthcare professionals. And the role of medical intuition for non-licensed healthcare professionals is to support a client taking this information to their primary care physician so they can get an accurate diagnosis. What we do is we
Mm,
give information that can be taken
right.
to the healthcare professional, and that's an important distinction to make. Now, don't forget, I do teach MDs. I do teach people who can diagnose, and for them, it's a wonderful way to integrate it right away. So the information part is what we're looking for here. And what we found with our graduates is we gave people a whole bunch of survey questions, and we were just so thrilled with the responses. We found that we got a 94% accuracy rate in location of primary healthcare issue and evaluation of that issue. 94% accuracy. And listen, I knew that anecdotally we had pretty good, you know, we were hitting it well. I knew in
Hmm.
my career, you know, I was getting about 80, 85, you know, percent accuracy rate. 94% accuracy rate. That was a wonderful thing to see. Now, we also saw 98% accuracy rate, according to these surveys, in description of life experience that is probable or possible. Now, it's the survey respondents, they're answering it. Yeah,
Hmm.
they
Right.
got my life experience, and made a correlation between the life experience and the healthcare issue. It made sense to them. So that was very high, 98% accuracy in description of life events. We had a 93% accuracy rate when someone made that correlation and the client went, yes, right on. And these are high numbers. We also saw this is the statistic that kind of turned the corner. We saw that we asked the question, how many people have had a known medical diagnosis, because we don't do an intake. So going backwards a little, none of the medical intuitives knew what their clients' issues were at all. So these were blinded sessions. I should have started with that. Blinded sessions, no intake, no dialogue beforehand in terms of their healthcare issues. And what we found was about half of the people had a known medical diagnosis they were aware of. They'd worked with their provider on it. We got another 94% accuracy rate on the consistency with medical diagnosis, known medical diagnosis. Now, this is significant.
That's very significant and very
right?
high.
Yeah, and very high. And
Definitely.
so what I did is I took all that data, and I'm like, I got to get this to somebody, And
Right.
I had a friend, a colleague, who works he's actually one of the professors at the UCSD, that's San Diego, University of California, San Diego School of Medicine. And he runs a research center there. And I sent it over to him. And he said, okay, it's time for a gold standard study on medical intuition. We finally have some evidence base to springboard from and create what the medical world needs and wants. And that is a strong, repeatable evidence base
Mhm.
that they can say, okay, there's validity here. And I'm over the moon about it. I mean, you can't really get better than this kind of perspective. And there hasn't been any kind of a gold standard study on medical intuition. There have been like 2 studies on medical intuition in the last 40 years, and they've been inconclusive because they haven't been to the degree that I was able to do with my students. So this is very exciting. We're excited about it.
It's really great, and this is a little known fact about me. I actually was a sociology major, and I studied social statistics and
Yes.
research in some level, and also as an attorney, you kind of sort of understand like the shifts of the sort of what's considered good science, or they shift, and it's so great
Yeah.
to see you really involved, because this is what's going to shift the industry. When we get published articles in the AMA, and then there's some support for that. Obviously, as we all know, the medical industry is much led by the drug companies, lobbyists, and what they can do to maintain their foothold in the
Yeah.
wellness stuff about but so their interest is not in healing
Yeah.
necessarily
Well,
people.
there's an industry there for sure. It's a for-profit industry, absolutely. But it's the people that want to heal. The
Right.
people want to heal, and the
Yes.
doctors want people to heal too. Believe me, they're just
Yes.
as invested. But here's the thing: there is a growing movement in the United States, and I think overseas as well, called integrative medicine. And the origins of integrative medicine, if I may, are that doctors were seeing their patients coming to them after going to the acupuncturist, and coming to them after they've gone to the Reiki healer, or the chiropractor. And they were moving along in their healing journey, and the drugs may or may not have been, you know, doing the job. And people are looking for alternatives is the point. And this has been going on for tens of decades, lots of decades.
Yeah.
And what happens is that the medical community started to realize that there's something there they have to pay attention to. And I don't know when the integrative movement started, integrative health movement. There's also functional health movement. These are MDs and allied health professionals that are realizing that they need to learn about these different modalities and skills and what can help. And I've been very blessed to speak at many of these conferences and say, not only do people need to know about diet and clean diet, and about Reiki and about healing touch and about you name it, they also need
Yeah.
to understand about intuition. And here's the interesting part, Travis. When I talk to doctors, and I teach at Andrew Weil Center to their young student doctors, uh, the idea of intuition is not foreign to anyone in the healthcare
Hmm.
field, even doctors,
That's a little
especially
surprising.
doctors.
Yeah. Yeah.
And there's been a ton of research on nursing intuition. It's very validated in nursing because they're taught to trust their gut feelings, right? That's
Hmm.
intuition.
Yeah.
And they're not trained in it, but they're taught to trust it. So not surprisingly, I do teach a lot of nurses, and they're wonderful. But the
Yeah.
doctors are also, if they have in their medical school, if it's discussed, they talk about spontaneous remission and idiopathic, diagnoses. Idiopathic means they don't know what it is.
Right.
And also how to use your hunches to follow your hunch, to follow it, to get to the correct answer. And that's intuition. So it's not as big a leap as you would think for MDs to consider the idea of using intuition and even consulting with the medical intuitive. Um, and that's what I do. I do a lot of consulting with doctors, and so do my students. And we do a lot of work with patients too. So it's fascinating work.
Yeah, it's really incredible. Now, do you still provide medical intuitive sessions on a one-on-one level, or do you only teach now?
Well, my main time is spent teaching, but I do one-on-one sessions, and people can go to the website, which is www.thepracticalpath.com. Thepracticalpath.com. And I do have sessions open. People can work with me. They can work with my graduates. If they're interested, I've got students who are finishing their case study hours. Those are free sessions for any of your listeners. If they're interested in that, they can help our students graduate. um,
Oh, that's wonderful.
yeah, and we have a lot of options for people to tap in and learn about this on the website.
Do folks need to be in person with the medical intuitive in order for this session to work?
Not at all. This is a remote skill. I do most of my work with clients over the phone. In fact, all of it now over the phone or over a Zoom like this. The classes are taught in this very setting, live online, with me teaching and a whole group of students from all over the world. And we work in this fashion, and it works perfectly. And it gets the students kind of facility with remote work. Now, it's not remote. You and
Right,
I are sitting here in the same cyber room. So it is one-on-one as far as I'm concerned.
right.
And it works that way. But we can also do remote work, and we know how to do that too.
Wonderful. That's so great. So now, do you have any other workshops coming up that you're teaching, or events that folks who are listening or watching can check out or participate in?
Yes, absolutely. I have my main program, which is a 9-month program. It's level 1 is 4 months, level 2 is 5 months. It is 1 weekend per month with homework in between. And so it's not, and it is a fast track program. You will get those. I can't make a guarantee, but I have to tell you, most, can I say that? Pretty much all the students who've gone through the program are getting those high accuracy rates really after 9 months of reading. I liken it to probably about 2 to 3 years of practice. That's how they're coming out, because it's a condensed immersion type of program for them, and it works. And it's exciting to see that work. So that is live online. I teach that twice a year. In the spring in March and in the fall in September. And that is open to wellness professionals of every kind. And I do have accreditation and CEs for certain groups, nurses, and where we will have acupuncturist accreditation. And I'm always looking for new ones. So if people have that idea, they can let me know. So there's continuing education. The other workshop is, it's a workshop. It's a 1-day workshop or a 6-hour workshop. Now this workshop is called Medical Intuition for Healing. That is open for anyone and everyone who wants to learn how to create the mind-body connection for self-healing. And that's a very powerful workshop. I put that one together because I had people saying to me, Wendie, I'm not a wellness professional, but I really, really want to learn how to work with my own energy systems here in my mind
Mm.
body. And I said, okay, let's do it. And this workshop is great because people learn how to develop a conversation between their mind and their physical body so that they can get information from their own body. How wonderful would that be if every client and patient could actually just have that dialogue? That's what I did to let that, little tumor release. So there are lots of techniques and fun things. Also ways to create energetic boundaries, to create grounding. There's certain things that some people might not have facility in, certain things that people have already known, like grounding, but I teach maybe a
Mhm.
different way to do it. I teach how to use that visual sense. That's the main thing. And it gets people, it's kind of a good introduction to the main program if you're interested. But if you don't want to take the main program or you're not a wellness professional, consider that workshop because it's really fun. It's online and you can see people's testimonials about it, what they thought of it. The other
Oh,
thing I
great.
can offer to you listeners is free guided meditations on my website. So if you go to the guided meditations tab, there are some basics. I call them energy essentials. Things that you can do right here, right now, a little 5-minute guided meditation by me, and learn how to ground your energy, learn how to create a buffer, for those clairsentients who feel like they're getting bombarded, learn some basic energy techniques to be in control or in charge of your energetic state at will. And that's something that intuitive people often feel kind of like, it's either there, it's not, and when it's there, it's too much, and I don't know how to handle it. And I'm giving you, there are tools and skills there that are free to use. And I've heard that people really, really enjoy. I get good feedback on that.
Awesome. Well, thank you so much. And I do know I often have a lot of clients and a lot of people that I work with who are accessing their intuition maybe for the first time, sort of on purpose and consciously, and they recognize that as their empath, as a term of art that we use a lot to talk about the way in which we understand and interpret
Yeah.
other people's energy, but then maybe have a difficulty in separating it from our own. So I think and appreciate how important that is, and so great that you offer those opportunities for people to really hone their skill in, and the free gifts and the amazing free meditations on grounding. Thank you so much.
Oh,
I'm
you're
so
so welcome.
excited to be able to offer that to folks who are watching or listening. And can you give that website to
Yes.
where folks can find you again?
Sure. It's The Practical Path. That's 3 words, The Practical Path .com. And you can reach me through there. And I can answer any questions about the programs or the workshops. Happy to do so.
Awesome. Well, thank you so much for joining me, Wendie. I am so grateful for the opportunity to share your incredible work and wisdom and tools and insight with listeners and viewers all over.
Thank you so much for having me. It's a true pleasure. I really appreciate it.
You bet. Take care.